to be able, we're hoping to, let everybody know what is ocular surface disease, how do we treat it, what are some of the cool new things coming out, what are some of the things we've been doing that are very revolutionary. Only a few practices in the United States are doing what we do. In fact, I lecture, as a lot of you know, internationally and nationally on this topic. And so we're trying to educate the world on ocular surface disease and how to get ahead of it instead of have it become such a burden to all of our patients, because it impacts so much of our daily living. So let's share screens, and I'm going to go over kind of what I talk to our doctors about. So you're going to get a sense of what I lecture on all the time. So here we go. So we're going to talk about new technologies and treatments for ocular surface disease 2022. Gosh, it's hard to believe we are there. So what is ocular surface disease? Well, it just means anything that happens to the lids, the white part of the eye, that's the conjunctiva, the tear film, and that front clear surface called the cornea. And when any of these things are in disarray, it causes fluctuating vision throughout the day, can cause pain, discomfort, and can cause even loss of vision. But we know there's a lot of different conditions that include the dry eye piece, those oil glands, which we have to say 20 times fast, meibomian glands, and blepharitis, which are a lot of the crusties and the mites and those fun things that come out to play on our lids and lashes. Rosacea. Now we're learning this connection, which Gabby has done such a great job educating all of us about ocular rosacea and facial rosacea. And when you're prone to facial rosacea, guess what? 86% of the time, you got it in your eyes too. So that is another part of ocular surface disease and dryness. And then, gosh, allergies. What are we dealing with right now? Tons of allergies. I don't know if most of you are, but man, I'm going nuts with the cottonwood flying all over the place. So what are dry eyes? Well, we know there are a couple of different types. There are normal tears versus these chronic inflammatory conditions that can cause dry eyes. And we know that 86% of folks with ocular surface disease and dry eye have it because those fragile little oil glands called the meibomian glands just aren't functioning very well. We used to think it was because the good old lacrimal gland wasn't functioning. Well, guess what? That's only 14% of folks that have ocular surface disease. So the majority, it's these glands just losing the ability to crank out beautiful, thick, lustrous oil. And we just start drying up all over the place, kind of like our skin. Our folks that have autoimmune conditions like Sjogren's syndrome, rheumatoid arthritis, and thyroid dysfunction, it's usually the lacrimal gland that's not working. And those folks are the ones that really benefit well from those T-cell eye drops like Restasis or Cequa or Xiidra, which we'll talk a little bit about. But we really realize that this whole population's changing. The last 2 years, oh my gosh, we've been doing more of this, right? We're all on devices. We all underestimate how much we're on those devices. Sometimes our wonderful phones will tell us, oh, you're up, your screen time is up from last week, 500%. No, not for me. I'm trying hard. But the addiction is there, right? We're on our screens at work. We're maybe on multiple different screens if we're doing remote work. And then we're also doing screen time when we're home on our lovely phones. But younger ages now are on screens. You know, kids as young as 4, 2. I've even seen parents throw on iPhones in baby strollers to keep their kids engaged and entertained. But we know this is changing, and it's changing rapidly since the pandemic, and we're seeing it here in our practice watching children's eyes, and it's been amazing how much change is happening. But we also know ocular surface disease gets induced by doing cataract surgery and LASIK surgery, all those refractive surgeries that are really cool to get you seeing 20/20 without glasses. But guess what? There's some underlying causes of ocular surface disease after the fact. It disrupts the cornea. It disrupts all the wonderful nerve endings that just won't tell the brain it's dry. So it causes a lot of letdown on tear production. Contacts. After just 1 month of wearing contact lenses, you start inducing ocular surface dryness. So we know that's another problem. And then cosmetics. As some of you know, we have our wonderful cosmetic tips and tricks guide now, which really helps us to educate our patients about whatever they're putting on their face or around their eyes really can damage those fragile little oil glands. So we want to be really conscientious about the toxicities of certain cosmetics, lotions, and potions. And that's, again, where Gabby really helps us out, educating our patients about some of the things they didn't even know they were doing that was contributing to their ocular surface disease. So we know from the data right now, at least 20 million people in the United States have it, although we think that number is far higher, probably closer to 5 times higher, because the pandemic just shifted us into using so much more digital devices. We think 92% on us as eye docs have contributed to this massive shift in ocular surface disease over the last 2 years. And we know that most people on these devices will complain of tired, burny, kind of dry eyes, or they just feel they have to get a break from them. And I kind of feel like even the kids knew this. They all were just so tired of online school, they just had to take breaks. In fact, it felt like they were all getting their candy and eating too much and then going, I can't do this anymore. So we know they even notice it too. But what do we do? What are some of the new technologies out there that are helping us, one, diagnose it and help us treat it? Well, one of the best that came out first was the tear lab. And that's where we're checking your salt content in the tears. As many of you know that are patients, we check this because we want to know your number. You know how we check for blood pressure? There are a lot of things we love to know, our cholesterol level, all those things that we want to know the number. We want to know the number of the salt in the tears. We know it's important to have it, but too much is not good. So I always tell people, think of the Great Salt Lake versus Crater Lake. And I want you more like Crater Lake versus the Great Salt Lake, which is dry and arid and desolate and salty, salty, salty. So those things are super important. I think we got somebody asking a question. Sometimes I can stop the share, but I don't think. I'm going to come back to it. So don't worry, those questions will be answered. Obviously, this patient is off the charts, not doing so well. They're at 350. We want to be 300 or under on your tear lab reading. So that tells me you're in that nice Goldilocks zone, just the right amount of salt, not too much, you know. And then we are looking at those meibomian glands. We can actually look in and peer in with our technology that we have now to see, hey, do you have a? And of those glands that are in the lower and the upper lids, are they working or are they atrophied? And this new technology has just given us eyes into areas we could not see before, which is truly remarkable. Unfortunately, not many offices have this technology yet, but it is becoming the gold standard of care. We also have another additional device that looks for dry eye issues caused by eye movement imbalances, eye tracking and alignment issues that can be causing ocular surface disease. So these are all important things we have to rule out and figuring out what's causing this. The other thing is we've got to get in there and take a look. We got to take a look and put those fun colored dyes, as you guys know that I'm so excited about. And everyone who comes in gets the OSU and the U of O dye put together. And we are always being very, general to everybody. Of course, we like the U of O, and I love that green that pops really beautifully. And that wonderful green dye will help me diagnose where the ocular surface is. So most of you as patients don't get to see what I get to see, but here's a picture of a patient who has massive amounts of staining on the front surface of their eye. That's the cornea. You can see their pupil, just that tiny little pupil. And a lot of people will say, I had one patient today who said, I've just been noticing this film in front of my vision, and my vision in my left eye is just not getting any better. And I blink a lot, but it just seems really hard to see. Well, sure enough, she looked just like this picture when we put the dye in, and it was just like a beaten metal appearance all across her cornea. This is a problem. We have patients who have this amount of damage, and their vision, the best they can see for a lot of times is 20/50, 20/60, even with their glasses on. This needs our love and attention, and desperately we need to flip the switch here and get them back to normal health. The most important place we start are the lids, and you've got this beautiful picture of this model. And we can see one thing in particular that is a naughty thing to do, but is very popular and has been gaining real excitement on YouTube. And that is, some of our patients who know this, answer is that person who's putting their eyeliner in the wet line, that beautiful green line there that really makes the eyes pop. It's called tight lining. And unfortunately, that's where all those wonderful 32 beautiful oil glands reside, and they're all being smothered by the makeup. And the chemicals that come with the makeup are damaging them, sometimes atrophying them completely out. So we have to be very careful with those cosmetics we use and where we put them, right? The same thing when we talk to folks about extensions. But now you get to see an up close look at what I see with the microscope, and why I was horrified after my first year in grad school, looking with the microscope and going, oh my God, I didn't know those things lived there. And I saw them moving, and that was like so freaked out. I became so good at lid hygiene. I immediately started washing my face at night and taking all my makeup off and throwing my mascara away every 3 months religiously. But was I doing that before that? No way. I was terrible. I was probably the worst patient ever. And I had acne and all sorts of breakouts. And now, of course, I know that was the rosacea talking. But if we look up here and you look at the top left corner, what we're looking at there is a lower lid, and you can see those beautiful lashes, but you can see patchy areas where there's a lot of lashes missing. And lashes are on different cycles, growth cycles. But what's happening is, if you see, it kind of has a glossy yellow tinge there. That is excrement from the mites that are inside the hair follicles. And in the middle picture, you can see, this is a top lid, you can see where those excrements are, and you can actually see some of the tails on those mites. You can see the tail of one of these lovely little mite guys. This is a Demodex mite. It is part of the spider family, and it goes head up into the hair follicle, and sometimes all you see is the little tip of the mite's tail, which you can see in those pictures. I hope you guys haven't had your dinner yet. And that's part of the mite. And then all the gooey stuff around there is the stuff they've been regurgitating, because guess what? They have no anus, so they regurgitate the tissue. Yay, yum, yum. And you can see cocooning on the next picture over to the right. The other thing I'm going to bring back to the picture right in the middle again is, you see those angry vessels on the upper lid there? That's the rosacea talking. So now we know the connection between rosacea, ocular surface disease, dry eye, Demodex, and gland dysfunction. Excuse me. Down into the left, there's some more pictures there of just some old makeup that's clogging into that wet line there. That is also causing a problem. And then in the middle there, you'll see some cryptic pictures. The one towards the bottom where it has a circle with a red oval circle, that's showing those meibomian gland pictures inside the lid, which is super cool. And you can see that whole area where they've lost all those glands. And it's, you know, more than likely something that's just been caused due to disuse. Because remember, when we talked about those digital devices, when we're on these screens, we normally would blink 20 times a minute, but anytime we're on a screen, it drops to 4 times a minute on our blink rate, which is a 5-time drop off in gland production of oil and tears. So we're just drying ourselves out royally when we're on these screens. So remember to kind of close and roll those eyes frequently throughout the broadcast tonight. The bottom right picture is a screaming red eye, beautiful green there on that beautiful iris there, but that's because there's so much dryness on their cornea. It's absorbing all that green dye, and it's all irritated, but you can see just the inflammation. That's lots of rosacea, lots of discomfort. You all wonder where that green dye goes, right? When we put it in and we look inside and I say, hey, there's a marked line. It looks like eyeliner, but it's that green dye absorbing in the areas that are only inflamed, dead, and devitalized cells. Now, if you look even more closely, if you look to the bottom lid and into the white of the eye, you see the brown, beautiful iris. But off to the side, off to the right side and off to the left side of that beautiful brown iris, you'll see the hint of a green line. And this is a person who wears contact lenses. They've just taken their contacts out, and the green dye is absorbing like a ring around the collar type of thing. The moment they took that contact out, the edge of the contact was bugging that person and rubbing, and etching away tissue, and the green dye absorbed in that area of those dead devitalized cells. So this is critical for us to look at when someone wears contacts, for us to be detecting these things, which normally goes unsolved. So what is this all about? It's all about inflammation. Everything that is dysfunctional in the body, when it happens, inflammation is part of it. What we know is that there's an inflamed lid margin, you're rubbing, you're itching, that causes a decrease in tear production because the brain's going, oh my God, how do I deal with this? Then as we age, we make fewer antibodies to fight against some of these nasty characters that live and breed around our eyes, which increases bacterial loads, increases more inflammation. All this stuff is dumping in there, kind of like a firestorm. And that adds kindling to the fire, to that inflammatory fire. So one of the ways we can get a hold of these little mite guys, get rid of that inflammation, help calm the eye down, and get to that place of homeostasis or the Goldilocks zone is by utilizing two new technologies. One is BlephX to clean off all those nits and all the debris from heavy mite activity. This is pretty heavy mite activity in that top left picture. And then once we get that area clean with the BlephX procedure, then we can do an IPL procedure or a temperature treatment. So we're going to show you what does a BlephX procedure look like. And you're going to get to see our lovely patient here. Dr. Coulter is going to be sitting in. I'm going to go ahead and highlight this. Marina is doing the actual procedure. So I want to make sure you guys get to see this. So I'm going to do a stop the share so we can get that going. And then Marina, I'm going to highlight you guys, okay? We're going to spotlight that. All right, so now you can get started. So she's using a special type of serum that we're going to be putting along the lash line here. This is a special tool specifically made to clean off that lid. It whirls in a very quick succession. It kind of reminds me like what we use a Dremel, but this of course is a soft piece. And we're going across that lid lash line to clean that area off. It feels really quite good. It might tickle just a little bit, but it doesn't sting or burn. And what's beautiful about this is we'll show you some before and after pictures. It does an amazing job at getting rid of the mites and surface helping us pull that out. Now remember, a female mite can lay up to 20 to 30 eggs per hair follicle. So it's a little bit of a process here, but it's very comfortable. How's it going, Marina?
How does it feel, Dr. Coulter?
Feels yummy.
Good.
No pain association?
Not at all.
Good.
Yes, we do the upper and the lower lids. It doesn't take very much time at all. And essentially, it's really no downtime from this either. You can come in. A lot of times we just have this is the only thing that we're needing to do with patients. They come in and we're usually done in about 15 minutes. We usually take before and after pictures so we can be sure that we're getting everything, kind of like, think of it like a dental cleaning. So it's your eyelash cleaning. This is also excellent for patients who have extensions and we have difficulty keeping those little bugs at bay. It has allowed some patients to be able to continue with their extensions because we can go in between and do a very good cleaning. So it's another good service for some of those patients. As a lot of you know, I'm not the biggest fan of extensions. She's just flushing her eye out right now because extensions cause the lid to be weighted down and it actually ages the top lid pretty heavily and causes more wrinkles. But it also induces more ocular surface dryness. Oh, very nice. She looks restored. Okay, so we're going to take the spotlight off of Dr. Coulter now, and we're going to continue back to where we were. Let's see. Okay. JD. I think I have that. There we go. Okay. Now I'm going to go back to sharing screens again. We're going to be doing a IPL treatment as well tonight. So you'll get to see Dr. Coulter again as our wonderful patient. You're going to get to actually see how we do an IPL. That's intense pulse light therapy. So again, those are the mites. Like we talked about, this is what they look like up close and personal. And they are funny little critters. They have a very quick life cycle, lasts about 20 days, but they're highly productive. And so we really want to get them under control. If your eyes look red and swollen, you have them. It's just common. Everybody's got them. It's just how bad is it? So that's why everyone knows how much I love lid hygiene products. This is our favorite go-to for everybody we prescribe. But for those folks who have that Demodex like that, we get them on a product called ZocuShield, which is a fantastic product that utilizes a major ingredient that comes from okra. So it's very, very safe to use. It is not tea tree. We try to avoid tea tree products now. It works beautifully and does a phenomenal job keeping these under control. So when we talk about ocular surface disease, you know, everyone talks about eyes, dry eyes, but really it's all about the lids. And I learned this lesson, unfortunately, really well in grad school when I had a teacher who basically told me, professor said, when you see a red eye come in, somebody with a red inflamed eye, look at the lids. And I thought, he's crazy. What is he talking about lids? It's inside the eye. Well, I learned that lesson the hard way when I had a patient and I wasn't paying enough attention to the lids. And yeah, they had the creepy crawlers. They actually had lice where you could see it crawling. And oh my gosh, I'm like, I will forever and always be looking at those lids. So please, please, please do your lid hygiene. We talk a lot about it with our patients, and trust me, it's important for your general health. So other treatments that are over the counter, what are some things we all can do to help ourselves out and get from getting worse? Well, lid hygiene, that's number one. And then warm compresses. You know, we love things like the Be My Lady Steam Heat Eye Masks. Those are wonderful. There are brooder masks you can heat up in the microwave. We know fish oil is fantastic. 3,000 IU a day of EPA and DHA combined. It's a really great way to go. But watch the fish oils you're using. Stay with things that are more like a Norwegian fish oil blend. The Norwegians are best known for their fish oils. It's one of their main exports. They don't have any nasty chemicals in them. They're what we call triglyceride-based fish oils, not the ethyl esters like you see at Costco and some other places. We just want to avoid those. So go with something like Nordic Naturals. That's one of our favorites. There's Carlson's, anything from Norway. And my Norwegian brother-in-law would be very happy you do, because Thor has been doing it since he was 2, and he's like very big on his fish oil, and I will recommend him every time. Artificial tears, we'll talk about which ones to use. Eye seals are some of those sleep goggles. They can help for our patients that don't close their eyes all the way and they have a little air gap and they wake up in the morning with burning. And then just blink. We got to blink more, guys. We got to blink a lot more. Close and roll those eyes, get those glands pumping. But here are some of the ones that we recommend a lot. The Refresh Optive Advance is good, but we've kind of been moving to the Refresh Omega 3 because it has a little more oil. Soothe XP is good. The Balance Group is good. Retain MGD is very good. And they have an actual gel too at night. That can be very, very helpful. All of these are adding to the oil that you're missing. Majority of patients need drops that help with oil. And the rest of them out on the market are a waste of your money and time. So Visine, get rid of it. Nafcon A, get rid of it. For some reason, pharmacists still love to recommend it to our patients, and we say, please throw that away because it has nasty, nasty preservatives that are stripping those oil glands. If you need something for redness, Lumify, that's a better choice, and you can get that at Costco now really reasonably, and it's totally safe to use up to twice a day. Allergy drops, we're fans of Lasticaf and Pat-A-Day. Those are also over the counter. They used to be prescription. Right now, those are good things to rely upon in these wonderful days. The oil-based tears are phenomenal. Amazon Wonders, as we call them, those are anything steam, heating, eye stuff. Those are great. Fresh Coat, those are really, really good drops for people who've had recurrent corneal erosions, and you can get that on Amazon. YouTube remedies. Oh, there are so many out there. We've seen so many crazy things. I would stay away from those. They are not FDA approved, and I don't want you throwing castor oil in your eye or taking flaxseed oil out of capsules and putting those in your eye. Those are not prepared for the eye and can cause some damaging effects. Coconut oil, though, go to town using coconut oil to get your makeup off. We've talked about that before. Totally safe to use if it gets in the eye. We like the organic kind, and that's the best one to use. All right, so what are some prescription drops? Well, back in the day, we only had Restasis that came out in 2003. And then it just finally, in the last 4 or 5 years, we actually have some others that have come out. There's Xiidra preservative free. All of these are twice a day. And there's Cequa preservative free as well, twice a day. All of these drops are going after the main lacrimal gland and trying to turn it on and reduce what are called T cells that cause tons of inflammation. They're the gangsters. They're the ones that are not ready for prime time, and they're causing all sorts of problems. Our folks who have thyroid dysfunction, Sjogren's syndrome, or any autoimmune condition, they need a little help from these T cell drops. So they're always going to need some bit of this, but we're hoping maybe we can get those patients down to just once a day. But those are the folks that need that. Regenerize has been newer to the market. It has amniotic fluid. We know that there's some really great things with growth factors and serums. Autologous serum, where they actually pull your blood, spin it down, and make your own PRP, is another thing that we've been looking at. But there's something else coming out that I just met with a CEO today and found out there's some other cool stuff on the horizon that may allow us to maybe not have to do those amniotic safer than some of these other products. So stay tuned. We're going to be really talking about that down the road. What are other treatments? Well, BlephX, you just got a chance to see that. LipiFlow was one of the first ones that came out probably about 10, 12 years ago. And we had limited success with that. We'll show a picture of that. It heats and squeezes the glands. That's another one with tear care. Radiofrequency and IPL, these are gonna become kind of our gold standards now. And punctal plugs. The picture that you see there that looks like, oh my God, what are they doing to the eye? It looks like, kind of looks like a little bit like a rabbit coming at the eye. That is called the iLux. It has limited potential. It was kind of good there for a bit, but it squeezes and heats. It can cause bifurcation of some of those fragile glands. So we don't use that technology. But here's BlephX. Here's a before and an after picture. So you can see how that quick little thing that we did with Dr. Coulter can do some amazing things at cleaning up that lid margin. And we do this a lot before some of our actual procedures if we have folks who have heavy Demodex and we need to clean that all up before we do one of our procedures. Fantastic. Again, think of it kind of like a dental cleaning. You know, the dentist, you do your daily cleaning and then the dentist goes in there and gets the extra plaque that we can't get to. This is what LipiFlow and tear care looks like. Again, you know, still around, but what we found with these technologies is they're limited. They have, I kind of want to say they're the one-hit wonder. They can give you some relief, but then it doesn't last very long. And so they get expensive to do these over and over again. So we want procedures that are going to give us good results, but have longevity built into them. So one of the best ones here is what Amy's in our practice is our star on radio frequency, and most of our patients love coming to see her. In fact, we've been very lucky. We've gotten a chance to try out one of their new hand pieces that's just made for around the eye. They've been asking for our feedback. And Amy, what do you think about the new handpiece?
It's amazing. It is so amazing. It's less pressure, which patients are loving. And it heats up so much quicker, which means that the treatment is shorter. And patients are absolutely loving it. Absolutely loving it.
Well, I can say I was the guinea pig. We don't let anybody do anything until that's been tried on me. And oh my God, I was in heaven. It just glides gracefully across the surface of the orbit. And I was just like, all I could feel was this amazing amount of heat. And to be honest with you, if I had had like a sinus infection, it would have like felt like it was opening up my orbits and immense relaxation. I just wanted to go take a nap afterwards. It was so wonderful. So I think that's why our patients love TempSure so much, is because the actual treatment is very, very soothing. And if any of you tuned in and saw Dr. Coulter having it done, she fell asleep on camera, which was great. It was so cool. So what it's doing is that handpiece is going across with a little bit of ultrasonic gel, and it's going across and it's emitting these radiofrequency waves deep down in the dermal tissue, exciting water molecules down there, and also exciting those little things that look like flying saucers in the bottom there. Those are fibroblasts, getting those guys to come back up to the surface and pulling collagen and elastin up. So guess what? That little divot you see on the skin, that's to show like a wrinkle. As we pull that stuff up, those things get smooth and effortless. To me, I love it because it tightens up the skin, right? And we also are heating those glands up to 42 degrees Celsius, which is the magic number to get them percolating and get that oil that's all clogged coming out freely and clean. So it's amazing. It gives me structure, function, tightening, and expression. It just feels great and marvelous. And then, hey, you might lose a few wrinkles in the process. Oh dear, oh dear. Here's a picture of IPL. This is where you guys are going to get to watch a treatment today. And essentially what we're using IPL for, IPL is called intense pulse light. And as you can see, that handpiece is going across the skin. And what it's doing is it's emitting these particular nanometer range in the 600 to 640 to 690 nanometer range, kind of the green spectrum. This is not a laser. That's why it's called intense pulse light. And this does an amazing thing at going after pigment and vessels. So it goes after that rosacea piece. And so when we are targeting these areas here, it helps us to eliminate those crazy, nasty, red, angry vessels. It also helps to kill the mites, and it'll cause more rejuvenation to the skin. So this has been in the aesthetic arena for a number of years, called a photofacial. It kind of does surfacing, resurfacing, and it goes after rosacea. So 80% of folks who have rosacea, facial rosacea, have meibomian gland dysfunction. This, as we know now, is a skin gland disease. So this is why we need to treat with IPL. The interleukin 17 encourages these T helper cells to infiltrate, and those are the nasty buggers getting in there, causing all that disarray and disruption. That causes that inflammatory cycle that we were kind of talking about. So if we get down into the down and dirty microbiology, IPL goes after those abnormal vessels and vaporizes them. It kills the Demodex. It does what we call photobiomodulation, which is a big mouthful for, hey, it causes a mitochondria in your cell, the generators to get back on churning, and helps with reduction of inflammation. So IPL is really a big game changer for all of us. The other things that we can do is autologous serum. That's what we talked about. We pull people's blood, spin it down, and make special drops just for them. It's expensive, and it's difficult to do now that compounding pharmacies aren't allowed to do this anymore in Oregon. So it's very, very hard to get. We have some patients that's what they were completely dedicated to. We have amniotic membranes that can help out some of those really glazed over corneas. We have punctal occlusion, and then sometimes we go to the real extremes where we pull out the white part of the eye because it's so damaged. Autologous serum, you can see on the left side. On the right side, there's a company called Regenerize that has these amniotic drops. The good news about that is they do work. Unfortunately, the bad news is they're super expensive and the supply is really low. So it's very difficult. You're looking at $500, $600 for just a 1 month supply. That's not really good. So we're looking at other things, and that's why I was sitting down talking to some amazing people today to look for other options that are more affordable. But some of you have had these done. We put an amniotic membrane in the eye. Yes, that's right. It comes from normal C-section births. These are all cross-checked and cross-matched to make sure that they're pure, they're cryogenically preserved, and then they come in what looks like a contact lens. We slide that onto the eye and we place it in there for a solid, almost a week. We usually put on Monday, we take off on a Friday. And these are amazingly regenerative tissue. This started because guess what? When we do those surgeries, when a baby is in utero in mommy's tummy and they go in to do a surgery, like they would do some heart surgeries, they realized when the kids came out and were actually delivered, there was no scars anywhere to be found. It's that wonderful regeneration that's happening from the amniotic sac. That amniotic membrane is hugely restorative and has amazing, amazing properties. So guess what? It went into burn victims, started using the technology there, and then all of a sudden it came to the eyes. So this has been around for quite some time, and we've been using these for about 10 years, and they're excellent. Unfortunately, they're expensive. Costs around $2,500 every time we do this. And it's, you know, has to be cryogenically frozen. It's a process. So again, what are other alternatives for us to use? But these work, and they work very well at reducing inflammation, improving growth factors. Literally, it's like when we take them off, it looks like a baby cornea again. It's just amazing what happens. We've had people who've had burns or they've had trauma to the cornea, it can heal it amazingly well. So these are wonderful tools, but they're extreme measures. Other tools we've used in the toolkit have been plugs. And a lot of people have come to me who have had long-standing punctal plugs. We've plugged the hole to try to keep the tears in. And now what we're finding is that's caused another problem, a cesspool of inflammatory mediators just sitting in there and not draining out. So what we're finding now is more often than not, I'm pulling most of those plugs, taking them out because they're causing more harm than good. So like everything, we realize that learning about ocular surface disease, the arc has swung very, very wide from back in 2003 when we were just using artificial tears, maybe some lid wash, maybe we knew about something, to Restasis, to steroids, which we don't like to use anymore, to all these other cool things that we have at our disposal. So now what I'm going to do is I'm going to switch back over so that Gabby is going to show you a treatment of IPL and how we do our IPL. So I'm going to switch over to her. And here we go. All right, Gabby, take it away.
All right, I'm hoping you can hear me.
Yep, we can hear you just great.
Perfect. So we have Dr. Colton here. We put on some titanium goggles for her to protect her natural eyeball. I'm going to show you what we do after we do our regular either full face or eye treatment. When we do the full face, obviously we get the whole shebang. We normally do this if someone has a pretty severe rosacea where it's also on the skin. But generally, most people get the eye treatment, which is from corners of the mouth to the center of the ear, this entire area. So just kind of leaving out the chin and upper lip and a little bit of the jawline area. So I'm going to pretend that we already did the whole dapping her face. I'm going to get my machine on, which is pretty loud. So let me know if you want us to put us on mute. It's going to sound like the range over your stove top. And we're just going to wait for that to warm up for a second. So we use some pretty gentle settings when we go right around the eyes. I'm going to be pulling down right through here so that we can get closer to that thinner skin on the under eye. I'll have a piece of cotton there to help me get some grip. But with all IPL devices, we're going to have some kind of either lotion or ultrasound gel to protect the upper layers of the skin. So I'm going to have us put on our safety goggles so that our eyes are protected as well. And once my device has a little bit of time to warm up, then we'll get her started. I always like to give people a countdown when I first do the first pulse, since we are going to have a little flash of light that Dr. Coulter will still be able to see. Your eyes are still protected. It definitely does startle people a little bit, so that is good to keep in mind. This is my handpiece. The gold is going to be the cooling tip, which is really nice for IPL. So this is going to help cool down so that when we have those hot flashes of IPL, it's going to feel very, very easy. we're just gonna have a little bit longer wait. All right, there we go. So I like to go ahead and start from the outside of face since there are less nerve endings there. So it's going to be a little bit less sensation. Plus, the closer you are to the under eye, the lighter it's going to be. So hopefully you'll be able to see. I might throw the left hand so you guys can actually see it. So starting over here, I'm going to give Dr. Coulter a 3, 2, 1. So that she can expect that light. 3, 2, 1. How'd that feel?
Oh, fine.
Easy peasy.
Wow.
Yeah, these ones around the eyes are pretty easy. So I'm just going to go through and get all these ones on this side. And we get pretty close to that more delicate skin. Since we are doing easier settings around this area. And we go right on top. I like to call it the snowboarder or skier goggles. Because we just like to get a good border around the eyes. And you have to be a little ambidextrous for this. Since the handpiece is pretty heavy, so you got to be able to hold it on each side. And I always like to get right in here a little extra because, you know, might as well get a little bit of extra collagen and elastin in the areas that we want to get a little bit extra heat. But otherwise, after all that is said and done, we go ahead and take off the goggles and we get our aftercare on. And that's our last step to our IPL treatment.
Awesome. Thank you so much, Gabby. As you can tell, it really isn't that difficult to do this. And, you know, it really kind of makes it easy, super easy to, you know, understand what we're doing here. You can tell also as well that she doesn't look super red and super irritated, so she can just put her makeup on and go right back to work, you know, doing whatever she wants to do. So there's no downtime at all for the procedure, but it is highly, highly helpful. It gets rid of the inflammation, gets rid of those vessels. We have a little bit of some aftercare that we put on just to kind of make you a little bit more glowy and feeling really good and cooling down. And sometimes we'll also go after some pigment spots that might be, you know, precancerous too. There's another setting that can be done with the IPL to deal with those as well. But, you know, Gabby's wonderful. She's been doing this for a number of years. She's just a wealth of knowledge when it comes to lasers and skincare. So she's really helped us as far as understanding the proper techniques much, much better than all of our doctors that do this. It's a different experience when you have Gabby do it versus me doing it. I will attest to that. So she makes it feel almost like a beauty treatment, but it's really critically important. So a lot of times we do a series of anywhere from 4 to 6 IPL treatments, and some people need IPL and radiofrequency together to help with lid, you know, apposition, tightening, and going after the vessels. So that is great. All right, so I'm going to bring this over to our wonderful Amy. She's going to talk a little bit about what we are going to be doing as far as kind of prizes tonight and what our loyal followers of our Glamour Gal series that are here tonight, what you guys get just for tuning in. Okay.
Hi, everybody. Sorry. Normally it would be Stevie here, but she decided that she needed a vacation instead of being here. So here I am. So, okay. So the prizes tonight, one lucky viewer will get a OcuSoft. So that's the lid wash that you're going to want to use. If you have allergies really bad, you're probably going to want to do it in the morning and at night. It's really important to do it at night before you go to bed, because if you don't do it at night, what you're doing is it's just like a well, cesspool. Really, it's just all those allergies in there just wreaking havoc basically on your eyes. So doing it at night is going to be your best bet. But if you do have some allergies, do it morning and night. It's not going to hurt you to do both. So if you want to be extra thorough, do it morning and night. And then also another prize is one person is going to get the ZocuShield. The ZocuShield is a little, what would you say, Dr. Foley, a little stronger than the OcuShield, or excuse me, OcuSoft. But the ZocuShield, you don't rinse that off. You take a little bit goes a long way. You put it right on the tip of your finger, rub it together, and then just kind of rub it into your lashes, and you leave it. You don't have to wash that off. And then, so normally what would happen is you would call by Friday night, Friday afternoon by the time we close, and you will get 20% off all of the treatments that we've discussed today. The Blefex treatment and the IPL. So anybody that is here tonight will get 20% off if you want to call. What you will have to do is you will call, ask to be forwarded to my voicemail, and just leave your name and your phone number, and then somebody will get back to you. I will just write it down that you were here in this event with us tonight, and we will make sure that you definitely get that 20%. So prizes, yay, I'm excited. I get to be Stevie today. All right, so I have my little bag. All right, who is the winner? Is it Cara?
Yeah.
C-A-R-A.
Woo! All
So
right.
that's one.
What did she get? What
She
did
will
she get
get
for that one?
That's the OcuSoft. I forgot we were doing two. My bad. And number two is Terry.
All right,
You get the ZocuShield.
Woo! Awesome, Terry. And Terry, by the way, did a lovely, on our Q&A said, as a very happy patient of Foley Vision Center, I can share that you don't realize what a drain dry eyes are and what a toll it takes on your brain and stamina. The surprise bonus of these treatments and products available from Foley Vision Center Clinic is that at the end of the day, you have extra energy and brain power. That's
Thank you, Terry. You're the sweetest person, I swear.
I know. You keep us going. You keep us going. That's
and
awesome,
she
Terry.
is here every event. Terry is here. So Terry, we, from the bottom of our heart, we appreciate all of the support that you give us.
Yes, we totally do. And that's what makes this all, this is why we do this. And I think yesterday we had so many wonderful patients in that were just saying, thank you so much. No one's ever caught this for me. And we had a lot of crying and hugging yesterday going on in the office. But that's why we're here, and that's why we do this. And this is what keeps us going. And I can't be more blessed and feel so lucky to have the wonderful patients we have. So we want to thank all of you for tuning in again tonight. Next month, it's going to be all about sunglasses and cool eyewear. Also sunglasses for dry eye. There's specifically ones just made to help reduce the wind now that we want to get out there and have some fun and reduce allergies and all that good stuff. So stay tuned next month, same bat time and channel,
Dr. Foley, so we just got a message from Kara. I'm hoping I say your name right. I will ask Gabby, but it says that it's Gabby's mother. So we can pass the gift on to somebody else. That's very sweet of you. Thank you so much. So let's see.
Okay.
It is Stacy.
Oh, Stacy. Awesome. All right, Stacy. So you've got an OcuSoft on your way, ready for you. Well, again, thank you, everybody. We are going to be looking maybe for 2023, moving these to the lunch hour. But for this year, we're going to stick to the 6 o'clock last Wednesday of every month, and we'll have something new every single month. Thanks for chiming in. We really appreciate it. We'll be putting this up eventually on the blog, so you can watch old ones if you want to. If you're really bored, check it out. Thank you again.
Bye, everybody. Have a great night.
Bye.